Hi all, this is Maylene Velasquez. I am a licensed clinical social worker and a registered play therapist. I also specialize in perinatal and infant mental health. Today I was hoping to discuss treatment of young children in what we think of the field of infant mental health, but generally refers to children ages 0 to 5. One of the questions that I've seen online recently regarding this population is how do you engage young children in counseling? How do you keep them interested in what you're working on? And what kind of treatment do you provide? In the area of infant mental health, we tend to think that children thrive in the context of relationships. And so all the interventions that we provide and all the treatment that we give to families involves engaging the family. So if I'm working with a 3-year-old, I'm really working in the relationship or within the relationship of the parent and the child. This is how I manage to bridge the field of perinatal mental health and infant mental health. Because I think that just as children thrive in the context of their relationships, the relationship is crucial to the parent's mental well-being. As we think about the infant mental health population, my recommendation is always going to be to include the caregiver in the session. Engage them in activities that are going to be attachment based and relational, where you're using the relationship as a guiding principle and as the vehicle for strengthening the tools, coping strategies, and whatever goals that you're working with the dyad. Of course, there's going to be situations where the parent's best interest might not be to be present in every session. For me, I make that recommendation only when the parent's level of distress is so high that they cannot be present for the child, specifically where trauma has taken place. However, if the parent is not available or if one of the parents is not available, I would engage another caregiver. The best way for you to be ready to work with the infant mental health population is going to be to obtain training in infant mental health. You want a thorough training that includes physical, social, and emotional development, training that teaches you about attachment, about how trauma shapes the infant brain, training that helps you to screen for developmental or emotional needs that the child might have in the event that there's other referrals that you might need to make, such as to a developmental specialist or an occupational therapist or a speech therapist. And then you also want to participate in a reflective supervision. Reflective supervision is a type of consultation that infant mental health professionals engage in, where they get to explore the different feelings and emotions that come up for them as they're working with families. So as opposed to supervision where you focus on maybe specific tools and strategies to try out, or supervision where you focus on the administrative aspects of your work, reflective supervision transcends inward so that you as a clinician can become more aware, mindful, and reflective when working with families. Recognizing that what comes up for us is inevitably going to affect the quality of the relationship. And that working with such a young population, especially when trauma is involved, can lead to high levels of stress and place us at risk for vicarious trauma. So maybe as you think about what training and what supervision you're going to engage on, maybe you're already working with young children. Maybe you work in an organization that's giving you a caseload and you want some tools and strategies and kind of ideas as to what you're going to do with the family and how you're going to best support them. I'm going to show you some resources that I personally find helpful. When I first started, one of the things that was really helpful for me is to have a manual or actual tools that I can review and show the family. When working with clients with young children, especially perinatal clients that are experiencing levels of depression or anxiety or OCD or PTSD or any of the other mental health complications that can take place when a child is born, I find that it's very helpful to provide parents with tangible instruction that is reasonable and realistic that they can apply to their day-to-day lives. Keeping in mind as clinicians that parents across the board experience high levels of stress when it comes to worrying about the well-being of their children and whether they're doing the best thing to support them. For parents that experience postnatal anxiety, postnatal depression, the level of worry can feel unmanageable. So it is important that the information that we're giving in a space of compassion, and that we're attuned to what the parent needs and how ready they are to hear the information. A manual that I personally like is the Partners for a Healthy Baby, and this is the Toddler's Month 19 through 36. They have different ages available, and like any other recommendation, this is one manual that I use, but there's so many that you can pick from. Check your local early childhood organization to see what manuals they're using, or contact your state's Infant Mental Health Association to see what they recommend and what trainings they have available. One of the things that I like about this manual is that it provides resources, focuses for each month of the child's development, and developmental activities that the family can do together. It also gives you a list of resources where you can learn more information or where you can recommend more information to the families you work with. Aside from a manual with information, you also want to know developmentally appropriate information. You also want to have some knowledge of development so that you can answer questions that might be appropriate for you to answer, so that you can refer as needed, and also so that you can support your family. There's many places that you can go for the developmental information. When I started, a book that I relied on a lot was these What to Expect books. So this one is What to Expect the Toddler Years, and it has just about all the information that you need that I think will be useful in your journey to becoming an infant mental health provider or strengthening your practice as an infant mental health provider. You also want to become familiar with the ASQ, or the Ages and Stages questionnaire. If you're not familiar with this resource, I'll put it down below so that you can check it out. But it's a basic developmental screener that helps you to figure out where the child is and whether the parent might need a little bit of information, or whether they might need to be referred for further assessment. As you think of diagnoses that might affect this population, one book that I recommend is the DZ 0 to 5. And this is a mental health classification system that was developed by the organization 0 to 3. And I have it right here. So this is the diagnostic classification of mental health and developmental disorders of infancy and early childhood. There is tons of information. It has a crossover to the DSM-5. And the difference is that these are how we appropriately assess the infant mental health population. So you're going to find disorders here that are appropriate for the 0 to 5 population. Something that I would recommend to go along with the manual is the DZ 0 to 5 training. Another thing that I really like about the DZ 0 to 5 is that on the back you're going to find a scale that assesses for developmental milestones and competency in different areas, which means that you can use the ASQ or you can use the screener that's on the back of this book. Another resource that you can use is if you have been trained in a parenting program, such as the Nurturing Parenting Program, then you can pick different sessions from within and bring them into an individual session with a parent, or a combined session with a parent and the child. And so I have my English and my Spanish book, and sometimes I might make copies and give them to parents. If I'm doing a telehealth session, I will take a screenshot of the page and then send it to the family via email for us to look at together during our session. Another book that I'm going to recommend is Becky Bailey's I Love You Rituals, and I absolutely love this book for the infant mental health population, in part because it's filled with different attachment-based or relationship-based strategies, songs, and little games that parents can play with their children that are going to help to strengthen the dynamic between the parent and the child. Keeping in mind that in infant mental health, we have a tendency to conceptualize childhood disorders within the context of what the parent relationship is like. meaning that as we work to strengthen the child-parent or the child-caregiver relationship, we're also working on meeting the child's emotional, behavioral, developmental needs. So this is a big recommendation and one of my big go-tos. I might have the parent buy the book, or I might discuss different strategies with them during session. Depending on the family that you're working with, you might find it useful to role play the activity that you're going to give before you give the homework. That's always my go-to. I like to show things because I find that even when things seem really simple, they can feel really scary and we can be really ambivalent about them if they're new and if they're different. So I'm going to do that with using something like my maybe, where I'm going to role play for the parent what they're going to do. And then I'm going to have the parent role play it with the child so that we can tweak it and I can make sure that, that the family knows what they're going to be working on between sessions. So I can use a maybe, I can use a pillow, I can use a doll, a stuffed animal, and sometimes I've used a puppet. So whatever it is that you have available, as long as you can show the family, what you want them to practice. The other thing that I'm going to recommend is a kinesthetic storytelling. And these are stories that we teach the parent to tell on the child's back or on their hand. So we're working within the relationship and within the context of respectful, loving touch. And so again, I'm going to demonstrate the different movements on my maybe or on my pillow, and then I'm going to encourage a parent to practice, and we're going to tweak here and there as needed. I have a video on that, which I'll link to the top, and you can check it out if you haven't. And I'll put some other resources on the bottom in case you want more information on this. The last tip to working with this population involves using some of the games that the family is either playing or some of the games that maybe the parent played with their own caregivers. This might involve a session where you ask the parent about some of the games and songs that they were told by the caregiver that the caregiver did with them as they were growing up. So this is a really good way to bring what we call in infant mental health as the angels in the nursery, which are good experiences that the caregiver had when they were an infant with their own caregivers, that they're now bridging and bringing into their relationship with their children. What you might find by having these conversations is that you might find some of the parents' ghosts. And so the ghosts in the nurseries are, as opposed to the good experiences, they're the not so good experiences that we had as children that then we bring into relationship with children. Whatever it is that the parent shares with you, make sure to create some space to process and assess whether those processing sessions need to be with the child present or whether they need to be an individual session with the caregiver. Aside from the resources that I gave, there's also other training in infant mental health, which I recommend, starting with a basic training in infant mental health, and then moving into a more in-depth protocol such as child-parent psychotherapy, first play, circle of security, Fussy Baby Network, or something else. I'll make sure to put some resources at the bottom so that you can increase your professional development when working with this very special, unique, and really amazing population. I hope that this was useful and helpful to your practice. If there's anything else that you would like to hear, please feel free to let me know. Thank you. Bye.